Hello, and welcome, boys and babes, to the Magic Hour podcast, a place where we navigate through life's peaks and valleys with all the vulnerability and shamelessness we can muster. With the help of world-class guests from all walks of life, we uncover new truths and valuable tools for manifesting our highest potential. I'm your host, Mercedes Terrell, along with my partner in shine, Jade Bryce.
Hey, you guys. So today we are covering a topic that most people think they know enough about to keep themselves healthy, our oral health. We know we should brush and floss our teeth at least twice a day, and we shouldn't eat too much sugar so that we don't rot our teeth out. We know these basics. But turns out we may all be hindering ourselves by not looking more deeply at how our oral health correlates to our overall health. So in this episode, we are going to cover all the bases and get straight to the root of why root canals, amongst other dental procedures, could be directly related to seemingly unrelated ailments.
Yes, this is one I've been really looking forward to, so I will waste no time. Today's guest is paving the way for oral healthcare and the oral healthcare movement toward holistic and integrative biologic dentistry. In addition to his dental degree and as a leader in his field, he has a doctorate in naturopathic medicine and is board certified in naturopathic dental medicine. His hopes are to reverse the negative stereotypes associated with dentistry through his dedicated application and integration of advanced dental technologies and his whole human approach to medicine. Having been featured in numerous dental journals, on television, and in magazines for the innovative care he provides, he is a modern pioneer in progressive dental care. He's achieved master status in the World Clinical Laser Institute and diplomat status in the World Congress of Minimally Invasive Dentistry. He's a member of the International Academy of Oral Medicine and Toxicology, International Academy of Biological Dentistry and Medicine, and the Holistic Dental Association. He is Oregon's only dentist to be board certified in naturopathic medical dentistry and integrative biological dental medicine. With a full-time practice in Portland, Oregon, his focus is on helping his patients achieve all of their health goals, taking a whole person approach to dental medicine. His goal is to help people understand how all of the systems in our bodies are connected, and with that, help us to recognize and value how our oral health is critically tied to our ability to be the happy, healthy, well-adjusted humans we were meant to. Please welcome Dr. Kelly Blodgett to the Magic Hour.
Thank you so much for that.
Yeah, thank you for being here.
So we've actually spoken to, I think, a friend of yours, Dr. Jessica Petros, on the show before, and she raved about you. So we knew we had to have you on.
That's so nice. Yeah, she's awesome.
Yeah, we love her.
Great. So I've heard you mention in listening to, other podcasts that you've been on and such, that you have history working in psychology and counseling before you had your career in biological dentistry. Maybe you could bring us up to speed on how you became, the human you are today and what brought you to the work you're currently doing.
Wow. I got to say, that's a great question. Particularly, I like how you answer or how you ask about kind of the human nature of it. I'll just share a little bit about myself, if that's all right.
Please, yeah.
So I'm born and raised in Portland, Oregon. I've spent pretty much my whole life here outside of the 4 years that I was in Eugene, Oregon for college. Have a very loving and supportive family. My parents grew up here in Portland. I happen to have an identical twin brother who is also a dentist. He practices down in the Dallas-Fort Worth area. And interestingly enough, he had always wanted to be a dentist. Coming through middle school, high school, I had no interest in that at all. As a matter of fact, what I was really interested in from taking psychology and sociology courses in college was how people think, how people behave, the choices that they make. So when I went off to college, that was kind of my vision, was that I would pursue psychology as a professional interest. And my big vision was, eventually I'll get a PhD. And I don't know why, it was just kind of what the future looked like to me. And so I pursued that. And by the end of my junior year in college, was ready to go off to a master's degree program. And part of my history that I think is important as to how I got here is that growing up, I really didn't have much of a spiritual connectedness to the universe. I would say I didn't believe in God, and it just, wasn't part of my life story at that time. And interestingly enough, my junior year of college, I met the woman of my dreams. She kept encouraging me to go to church. And I was, of course, selfishly just no, I don't want any of that stuff. And we both were applying to the same programs for our master's degree. we both got into the same programs for our master's degree. So we're starting to look at life together long term. And I'm happy to say this will be our 26th year of marriage. So that part of life seemed to work out. But spring, it was actually 27 years ago this month that I came to know Jesus, and I came to understand the God of the universe, and really kind of opened my own spirit to what the universe wanted me to do. And it was, I mean, this might sound a little out there, but
not for our show.
Yeah. Well, this is perfect then. I mean, I had spent 4 years going in one direction that I thought personally, like, this is what I'm meant for. And when I opened my energy to the universe, like, it was very clear that was not what God's intention was for me. And
can I ask what your first direction was? What specifically?
Oh yeah, I mean, it was very clear in my mind. I was intending on becoming a clinical psychologist and working with people, to optimize, human performance or thinking or behavior or what have you. And it turns out I'm doing that. So all of that experience is really put to use on a daily basis. But what I heard God calling me to do, I mean, I'm talking within the week after I came to Christ. I mean, he was saying, I want you to be a dentist, and I want you to reverse the negative stereotype of dentistry. I mean, I could just feel it in my soul, and I'm thinking, why on earth would I be called to this? Especially when I have an identical twin brother already going on that path, right? I don't want to be him, So, I mean, it's a long story to share about how he really paved the way for that to happen for me. And, I've just kind of taken life every day as best I can, one step at a time, and continuing to pursue that mission. And I mean, these kinds of things keep happening in my life where, folks like yourself reach out and say, hey, let's shine a light on this subject, because really, I mean, you've talked to other health professionals, certainly, and probably in your own life experiences, found that, dentistry is this, this secondary thought in healthcare, or at least it is for most people. And even the way that we are taught to approach it in dental school is so symptomatically driven. We certainly don't think a whole lot about the connectedness of what happens in the mouth and how it influences our body as a whole. So that's been part of my mission, is to take these opportunities, as you were listing off the number of advanced certifications that I've pursued over the past 20 plus years. It sounds like a lot. And I think, gosh, I spent a lot of time doing this, and I've been raising 2 daughters with my wife at the same time. They're at that stage now where they're kind of getting ready to launch into their own lives, into college and such. But I mean, the truth is, I'm super passionate about this. I'm super passionate about helping people optimize their own health and life experience.
Yeah.
And also learning to feel loved in an environment, where I think we could all agree that and not just medicine and dentistry, I think in a lot of professional endeavors, there's kind of like, well, I'm the health expert, I'm going to tell you what you need. And that is absolutely the opposite approach that we have in my practice. I mean, we are here to listen to each individual, understand their story, understand where they come from and any fears they might, be dragging along with them. And then kind of, once we've made a human connection, then get into, all right, let's talk about all these things that might be going on with your oral health that are influencing you systemically. But until we connect as human beings, like entities of universal light, how do we expect for there to be a good connection, right?
Yeah. Absolutely. I think, and there's so many things you mentioned there that I'd like to touch on. And it sounds like the way that you explained your story there is the fact that you were, for whatever reasons, directed first towards studying clinical psychology and wanting to have human connection, because I mean, that's a huge part of that job if you're going to be actually counseling people, became this foundational piece for you to build this new venture that you decided to take instead. And I don't even want to say instead, because like you're saying, it seems like so much of your work in dental medicine is tied directly to how you essentially counsel your patients. So first I want to ask you, how does your background in psychology play into your dental office, like when you're sitting with a patient?
Sure. Well, so I'll try to paint a picture for you. Part of our experience here, I've been very blessed to bring 4 hygienists on my team over a period of about the last 6 years, almost 7 years now, where I started with one who was really inspired to help other humans. And I trained her to communicate the way that I used to do it, because, you know, for a long time when my practice was smaller, I would do the new patient experiences. So we trained them to ask human-based questions. So what I mean by that, and I'll share with you part of my belief system. I believe that people come to us and with answers, like they already have the answers. And I really gathered this when I was a junior and a senior in college. Part of my psychology background was that I worked on the crisis line at the University of Oregon, which, you know, that was a real eye-opener for me. One of the things that I came away from that with, however, was that people would call in crisis and it would seem as though like, oh, they just didn't know what to do. But if I were just present with them and continue to ask thoughtful and reflective questions, they would find that they had the answers themselves. They knew what to do. They just needed to somehow give themselves permission or something, right? So that's a lot of how we approach things in our practice. And we've created, I mean, for a lot of people that, you know, if you take them from your reception area straight into a dental chair, right, the palms start to sweat, you know, it's this weird, uncomfortable situation, and understandably so. So we've actually created a room in our office. It's not big. It has 3 very comfortable chairs. It's very kind of light and airy feeling. And our new patient experience in our practice is 2 hours long, and it's unstructured. Right? There's certainly information that we would like to gather, but if that person wants to spend 2 hours talking about their story, we're going to do it, right? It's in this environment that has nothing to do with dentistry.
Right.
It's just human to human. It's almost like if you were going to see your counselor, right?
Yeah.
Except for more comfortable, you know? And so we allow the patient to drive the pace of the conversation, if that makes sense.
Yeah, no, it's beautiful. I think the listening skills it sounds like you picked up, or maybe you were already prone to having, worked really well throughout your other career choices here. And I wanted to ask too, because you mentioned you have this twin brother, and I always thought, you know, I have siblings and sisters, all sisters, and thinking about having a sibling who does something. I'm the older sister, so you know, I'm usually the one who does it first and then they could follow in that wake. But when you have a twin who's already a dentist, does that help you to be like, well, I can literally see myself doing that? I mean, it's literally, I can do that because I know if my brother can do it, I can do it type of thing. I always wondered if twins have that kind of almost a one-up, like in a sense, you have someone who you know has pretty much the same physical capabilities, you know, has a lot of the same stuff going on that you do. And if they're doing it, you're like, that's a vote of confidence in your direction.
Yeah, absolutely. It was an interesting story, actually, because although we were, you know, born on the same day and all that stuff, the way that things worked out, I ended up starting dental school 3 years ahead of my brother. So the year I was a senior, he was a freshman, and we were at the same school up in here in Portland. And then when he came out into practice, this was like, 2003-ish. I was already knee deep into progressive laser technologies and being fairly active in the Academy of Laser Dentistry and things like that. And I'd made some good connections with amazing mentors. And it was kind of nice to bring him into that fold and just share with him, like, this is where my expectations are for myself based on, you know, the inspirational leadership I'm getting from my mentors. And he hopped right on board with that. You know, he's had a real shift since he moved from the Portland area down to Texas, and he now works for somebody else. But I it's certainly, you can imagine, right? He and I geek out on this stuff a lot. We text about things, and, you know, Thanksgiving dinners can be a little drab, you know, in terms of conversation, but there's always a lot of oral health stuff going on with the families, but it is nice to have that in common.
Yeah.
It's interesting that that's the path that our lives were taken toward.
So you living in Portland and your practice being in Portland has to be a world apart from having a practice in Dallas. Just I'm thinking the mentality of the people in Portland, which I visited, Jade has visited with me, they're just wide open as far as the way that they think about stuff, especially when it comes to holistic medicine. So has there been a big resistance over there?
It's, you know, one of the things, I have to speak to Portland as a native, right? It's a very interesting situation where we have, you know, a phenomenal naturopathic medical school here, right? One of the best in the world. And we also have Oregon Health Science University's School of Dentistry, which is very traditional. You know, I've had the opportunity, thankfully, probably like the two of you, where you travel a lot, I've spoken across the country about different dental things. And I have to say, this is just my observation, that the closer we are to a dental school, the more constipated the thinking, generally speaking. Not totally, but what I think is an advantage for our practice and our environment is that we do have so many naturopathic physicians, chiropractors, healthcare providers that think outside the box. Like we tend to connect with the Dr. Jesses, right? I mean, that's how I came to find her, is she was looking for a dentist who was savvy in safe mercury removal and things like that. I still get a fair number of arrows shot in my back from, dentists in the area, and we'll probably spend some time talking about root canals today.
Yeah.
I through social media get a lot of arrows shot my way with respect to just trying to bring things up. Right. And one of the things you'll find, I suspect, is that I really don't care if anybody shares my view. Like, I'm not here to convince anybody. I just want to share information and encourage people to think. I think if most people have the right, truthful information, they will make the best choice for themselves, whatever that means, right? So I think particularly when it comes to something like a root canal, like, you can absolutely choose to do a root canal on a tooth. It is a choice you are empowered to make. It's just that dentistry overall doesn't share with people, the numerous downsides that are going to come along with it. It's just, oh, well, you need a root canal. And again, there's that mentality, right? We tell you what you need, and you just sit there and nod your head and go, okay, you're the doctor, you must know best, right? That's a real problem when limited information is being shared.
Yeah, absolutely.
I always wanted a twin, and every time I would tell my mom that, she would say, well, maybe you have one out there. So what is the difference between a conventional dentist and a biological or holistic dentist?
Awesome. Love this question. And I get a fair amount on Instagram and Facebook, actually. I like to try to make things succinct and understandable, right? So when I think of the mindset of the traditional and or conventional dentist, which, more power to them. That's how I was trained in dental school. We were trained to think in terms of treating symptoms, okay? And when I talk with other more integrative and holistic healthcare providers, both in dentistry and otherwise, they tend to be more systems thinkers, right? So it's kind of a symptoms versus system thought process. So for instance, might be, in dental school, our first thing is, again, we go greet our patient in the reception area. We're straight into the dental chair, right? We're getting right to it. We're gathering data, and then I'm going to tell you what you need. We're looking, like back in those days, let's look for holes in teeth, right? Can we drill and fill? Can we justify drilling and filling? Because that's what we were trained to do. Is we see a symptom, we drill it, we fill it. But if you stop and think about that, right? The tooth didn't develop a hole because it had a lack of a filling, right? So the filling isn't the answer to why the hole got there in the first place. It's a little weird thinking, but we have to consider, why did the hole get created, right? So if we're just drilling and filling, it's like, the best analogy I can think of is your house is on fire, right? And you're calling the carpenter because you're concerned about replacing the roof, not the fire department, if that makes sense. So that's kind of, it's really a difference in how we approach our thinking for care. My goal is, if I have to provide clinical care, ideally I would like to do that one time and not have the symptoms return. And in order to do that, I have to first address the system that caused it. So we spend a fair amount of time, particularly my hygiene team, extremely bright people. We have to talk about diet, which I suspect we'll talk a bit about today, because it's so critical, right? What we put in our mouths makes a huge difference. And then, of course, what we put in our mouths, usually we're going to ingest. So what goes down our gut, that makes a huge difference because it comes back through the blood system and such and affects the teeth internally. So we have to think in terms of systems first, and then we can deal with the symptoms later.
Yeah, absolutely.
So what are the areas where a holistic dentist performs differently from a traditional dentist?
Well, so I want to provide a little clarification on this because I think it will help. I think it will help the people who choose to listen to this podcast. So first and foremost, if somebody goes online, let's say you're in Atlanta, right? I'm just picking a city, and you type into your Google search, holistic dentist Atlanta, right? And then a bunch of names pop up. Just because they've chosen to use the word holistic or or integrative or biological or whatever the term du jour is, And thankfully I've been in dentistry long enough to see, the different iterations of what is in style for marketing, of course. Just because they say, we're a holistic practice, I would encourage people to dig deeper and find out, what does that mean, right? Because I talk with people on Instagram from around the world on a daily basis who are saying, hey, I just went to a holistic dentist and they're telling me I need a root canal.
Right.
I'm like, okay, time out. So the first step, and again, this is just Kelly Blodgett's opinion on this, right? So take it for what it's worth. There's a heavier focus on the goals of the patient in holistic dentistry or integrative dentistry, which I believe respects the autonomy of the patient. So rather than this being about, you need this because I'm telling you so, it's more about, tell me what your goals are and how can we help you meet that, right? Because this is your health.
Right.
And there's a huge, at least in our practice, a big focus on relationships, which really supports the notion of trust. If there's trust, that's the hardest thing to establish, right? The clinical stuff is a lot easier, quite honestly. I would say in most holistic practices and integrative practices, big focus on diet and gut health and lifestyle. Frankly, that's the big stuff. I can't control somebody's diet, their lifestyle. I can make recommendations, but they have to walk it out. I will say, thankfully, something I've observed over the past 4 to 5 years that we've been on this path is that most people who are seeking us, they've already chosen that lifestyle, right?
Mm-hmm.
That's why they're seeking it out.
That's true.
And I like to acknowledge that, like, thank you, for being a kale loving green juicer. I mean, because if somebody comes in and says, gosh, doc, I'm concerned about why I keep getting cavities and they're sipping on a 32-ounce Diet Coke, it's like, okay, or it could be kombucha for that matter, anything sweet and acidic or acidic, it's like, okay. Something you're probably going to notice in holistic practices is marketing around mercury safe or mercury free,
Right.
those sorts of things. And both the IAOMT, the International Academy of Oral Medicine and Toxicology, and the IABDM, which you mentioned that I'm a part of, they both have almost identical protocols. And both my partner and I, we follow those protocols. So there's one thing to say, well, we're mercury free because we don't put it in your teeth, right? But when you're taking it out, that's creating quite a bit of, vapor. We already know that they give off vapor 24/7. And when you heat up mercury fillings, vapor, you're increasing it due to the nature of heat. You're increasing the amount of vapor you're exposing yourself to. So you put a handpiece on that, right? Something that's spinning at 200,000 RPMs, that even with all the water, it's going to create some heat. So we employ these protocols for safety of the patient and the safety of, the dentist and our team members, because we have to do this every day. So yeah, look for, those protocols. The one that the IAOMT came out with called the SMART, cute acronym,
Okay.
right? Safe Mercury Amalgam Removal Technique.
Okay.
But it's awesome, right? I mean, if you're going to have mercury out, find a dentist that follows those protocols
Okay.
for your own safety.
So following the SMART protocol, and would you say that holistic dentistry guidelines, if we can call it that, would say to not use fluoride? Any other specifics that you might be able to call up a local dentist who says they're holistic and test them to figure out?
Well, and again, I think that fluoride's an awesome thing to discuss because, we could spend all day talking about fluoride alone, of course, but without question, right? Fluoride has been proven that if you put it on the tooth, it's going to make the tooth surface more acid resistant. So, that one little thing, we can look at that and go, oh, well, that sounds great. And of course, that's what the American Dental Association is like, they've been stamping that into dentists for years. Like, well, you got to fluoridate everything, including the water.
Right.
But interestingly, studies have shown, first of all, ingestion of fluoride. So, if you live in a place that has fluoridated water, provides no benefit to your teeth. We know that for sure. Now studies are starting to come out looking at fluoride exposure internally, both through our gut, and when you put that fluoride varnish, let's say, on your teeth and your mucosa starts rubbing against it, I mean, you're absorbing that transdermally, right? So we understand fluoride being a neurotoxin will have an effect within your body. So they're actually finding that areas who have fluoridated their water, children are starting to, be shown to have lower IQs and other cognitive mental deficits.
Wow.
Which, I mean, at least in controlled studies, they've shown that. My thinking is, why complicate this, right? If we were intended to have fluoride every day, all the time, I mean, I really believe the planet would have been designed for us to have that, right? So kind of like if we look back on a history of decay, for millennia, tooth decay wasn't much of an issue up until, we started, making more of a carb-centric diet.
Mainlining sugar.
And that's the real biggie, right?
Mhm.
Is super processed foods, and in particular, processed refined sugar,
Mhm.
right? I mean, it's horrible going in your mouth. It's even worse when it hits your gut. I mean, the stuff that it does to the rest of your body. So fluoride, in my opinion, it is not the answer. It's not a panacea. We have some available because, I mean, some of our patients just believe, like it's been
Right.
drilled into them, pardon the pun, that, I just have to have my fluoride, right?
Right.
It's like, and who's to say, right? If they feel better about having it, maybe just that emotional positivity is better for their health overall, so be it. And if we're only putting it on their teeth once every 6 months to 12 months, it's probably not going to kill you. Thankfully, in Portland, we're a non-fluoridated community, so we're not getting it as frequently. But of course, with as much as people drink bottled beverages that are, made in places where, the water is fluoridated, you're still getting it. So it's not a panacea, but if we want to respect people's autonomy, right?
Right. And not exactly. And I mean, I'm so glad to be a part of and be seeing an uprise in holistic medicine, in people really going back and looking and thinking about what they're putting into their body and how they're treating their body. And I think we've been really misplaced from our bodies for so long. We've been separating ourselves from being in touch. Especially, we could go into like how the patriarch has to do with that and all this, but I think we're really returning. It's going to take time, but I'm glad to see that happening. And so what I'm hearing here is that if you were to be a person who's looking for a biological dentist in your area, for instance, you might be able to find out if they are supportive of the fact that root canals are not maybe the best process for digging into a tooth that has a deep cavity. There are other options, which we'll get into, in order to fix a problem like that. They would be someone who is not pushing fluoride all the time, and someone who also is using the SMART protocol to remove mercury fillings and such. So I love all that. That's a really good start. I think that's a really hard, like when you type into Yelp, holistic dentistry, everybody comes up with that, or biological. Every dentist that I've been to and know that they are not, doing those practices. So it is a tricky thing. I wish maybe there is, but if there isn't, I would love it. If someone listening to this, if you, Dr. Blodgett, have the ability to put together a list of people who are certified in that area. Does that exist? Are you on that list?
I would share this with you. I mean, there's a lot of different ways that people could go about finding somebody that's great. One of the services that, and this kind of got stimulated by the fact that in Oregon right now, like most dentists in the country, we're not practicing, right? Our governor has, told us outside of emergencies, you're not seeing patients for at least right now 3 months, right? So, but that doesn't mean people don't have dental issues. It doesn't mean they don't have questions and they want to take advantage of this time to do some research. So anyways, one of the services that we offer, if people go to our website, blodgettdentalcare.com, they can ask us questions, one of which you can click on a button and say, please help me find a dentist. Because what we're good at doing is sifting through the baloney, It's one thing to say we don't do mercury, we do SMART protocol, we don't do root canals, but how do you care for human beings, right? And thankfully, I'm fairly well connected and continue to develop the group of people with whom I'm connecting, particularly on a national level, so that we can make referrals. Because that is the question I get more frequently than anything on social media is, Dr. Blodgett, do you know somebody in Bozeman, Montana? Do you know somebody in, Columbus, Ohio? And I'm working on that, right?
Cool.
So if people want our help, we're happy to provide that. Any of the groups that I'm a part of, like the IAOMT, the IABM, you can go to their websites and they have hey, which dentists are close to me, right? And so those are also good resources that you can utilize. But I encourage people to, dig deep. Because as you mentioned, I so appreciate you mentioning that. It is the term du jour, right? With as fast as we're popping up Whole Foods markets and all that good stuff, people are hopping on the bandwagon of, oh, we're holistic too. Well, what the best question, well, not the best, one of my favorite questions, I'll put it that way, that I have my front office team members ask is, okay, we love that you're looking for a holistic dentist. Out of curiosity, what does holistic mean to you? Because if we don't understand that we're simply making assumptions based on our own beliefs about what we think it means, right? So once we, again, it's all about let's open this to conversation and get clarity, right? And then we can have better dynamics and communication.
Beautiful. Yes, I think that's an excellent resource. So thank you for providing that. So let's dig a little deeper into some stuff that I think people will be even less familiar with than what we've already discussed here. I want to talk to you about what the meridians of the body are. First of all, just the meridians of the body. We'll get to specifically how they tie into teeth.
Sure. And you know, for clarification, I'm not an acupuncturist. I've never done acupuncture. I've had it done on myself. And if I might just share a brief story about
please.
and my appreciation for energy meridians. Just about 10 months ago, I had a total knee replacement on my right knee, which, you know, there are more fun things to do, I can assure you, you know, but 30 years of wear and tear finally took its toll. I had this knee replacement done very well, but I was in constant, significant pain for 6 months. It was over 6 months. Finally, at the advice of one of my hygienists, I went and saw an acupuncturist who focuses on orthopedic acupuncture. And after the first treatment, it's no joke to say at least 80% of my pain was gone. And I was like, wow, I mean, I believe in it, you know, I know it works, but this was like life changing. So like, I'm trying to think of the name there's a book called, and it was recommended to me by one of our patients who's a licensed acupuncturist, called The Spark in the Machine. And if anybody who's listening to this is interested in understanding the how and the why of acupuncture meridians, where they come from, why they work, the author, who's both a traditionally trained MD from England, then went on to get his doctorate in acupuncture medicine. He does a beautiful job of explaining, kind of from a Western approach, the how and the why that acupuncture meridians and energetic meridians throughout our body work. You know, thinking along the planes of fascial tissues and how our bodies transmit energy. He does a great job of explaining all that. As a very simplistic acupuncture student, I would look at the fact that, you know, our bodies are 99.9999, you know, some crazy amount energy, right? We're almost very little matter. So it makes sense when we gain an appreciation for how we can influence the energy, how we can then reshape or affect how that energy is distributed, or we relieve blockages or what have you, right? So they exist. It's not my area of expertise. I am becoming more of an aficionado of the dental meridians, which we'll probably talk about.
Absolutely. Yeah. And to give just the listeners a, definition from the Google dictionary, we'll call it Wikipedia, of what meridians of the body are. It's listed as traditional Chinese medicine describes meridians of the body as a network of energy channels. These channels are thought to connect to the surface of the body with the internal organs. As long as qi energy can flow through these energy channels in the quote unquote Goldilocks zones, not too little, not too much, disease can be averted. So that's what we're talking about when we're talking about acupuncture, opening, with these little needle points, opening up or slowing down the flow of this qi energy to the different organs, to the different places, like in your knee pain. So now that we have that foundation, how does this all work with the teeth and the meridian tooth chart?
Yeah. So one of the things that I found interesting as I started getting into this stuff was to appreciate that our teeth are derived from the same embryological tissues as our central nervous system. So when we think about that, right? I mean, your spinal cord, all the nerves that come off of that, it's all connected to your teeth. And where I started really gaining some appreciation for the connectedness or the influence, shall we say, of what we do to teeth and areas of the mouth and how it affects us systemically, were through people's stories, right? They would come in and say, gosh, I had this root canal or these two root canals. And I mean, maybe it's just me, maybe I'm making it up, but I have not had the same energy ever since, And I mean, I still remember the first patient who called our practice and asked, would we please remove these teeth? I know that they are affecting my health. And, you can imagine, this is probably 5 years ago, my front office person at the time, their eyes were like wide open, like, you just want to take out teeth, right? It wasn't something which we were experienced with at the time, but it's what opened the door, right? So I'll share it. If we look at a tooth energy meridian chart, let me just share something like wisdom teeth. Okay. Let's take wisdom teeth because it's an issue where so many people end up having their wisdom teeth removed. And I'll probably talk later about the concept of cavitation lesions and how they develop, which is trapped infection. Once you've had a tooth removed, soft tissue closes over before the bone heals and you got junk in there, right? So the wisdom teeth meridians are connected to the heart, the duodenum or duodenum, however you like to say it, right? The junction right at the end of your stomach as it starts turning into your small intestine. The terminal ileum, so the far end of the small intestine. Your shoulder, your elbow, your hand on the ulnar side, so outside if you want to consider that. The SI joint, the sacroiliac joint, and your feet and your toes.
Okay.
And what is interesting is I think that, let's say, and we, depending on who you read, some studies say that as many as 75% of wisdom tooth extraction sites develop cavitation. So chronic infection in your jawbone. And if we understand that that's on your heart meridian, we would be wise to consider like, well, what kind of systemic effect might that have on the heart, right? Or joints, something like that. Another area that I find just incredible because of, if you look at the ridiculous rise in breast cancer over the last 80 to 100 years.
Yeah.
There are a total of 10 teeth in your mouth which are connected to the breast energy meridian. They're your upper molars, right? Upper second premolars and all four of the lower premolars. So imagine, if somebody has a root canal outside of trauma to the front of the mouth, the vast majority of people that I see who have root canals, they're in posterior teeth, right? So your odds are pretty darn high if you've had a root canal of it being on your breast energy meridians. And so here's what I think is really worth considering, right? Let's say, God forbid, a person, notices lumps, they go in to see their doctor. Oh yeah, we do the mammogram. Sure enough, you're diagnosed with breast cancer. At what point in time are they referred to their dentist to assess whether they have root canals and or the health of the root canals, which I'm here to tell you, if you have a root canal, it's infected, right? That's been my own finding. It's been the finding of other people who've looked into this. They're all infected. So if we know that there's chronic inflammatory response on that energy meridian, of course we should expect that the tissues connected to it will also be affected. But nobody makes that referral, right? The dentists are not never, but almost never brought into the picture, which is so unfortunate.
That brings two things to mind. And firstly, the insurance that I'm sure is not covering a lot of your practice, which wouldn't direct someone with breast cancer to their dentist, because then that creates a whole nother issue in insurance. I don't know if you have any words on that. But the other thing that brought to mind was this uprisal right now of explant surgeries when it comes to breast implants and other maybe butt implants or whatever places people are getting implants, anywhere that's actually having a surgery that could potentially leave behind dead tissue, right?
Right. Absolutely. Yeah, it's, and I'm not a plastic surgeon, but one of the things I often say jokingly is like, I think general surgeons and plastic surgeons, in some ways their job is a little easier in terms of infection management than what we're dealing with, right? If you have an explant surgery or you have a knee replacement or you have some other surgery, you can pretty much control sterilizing the area prior to surgery. You can pretty much control.
Can bandage it.
You can protect it in the mouth. People, unless you're going to put them on an IV and give them dextrose and, for 2 weeks. And even then the mouth is, it's the beginning of your GI tract.
Yeah.
Teeming with bacterial. It's impossible to sterilize it, right? I know in the knee surgeries I've had, I'm coated in that betadine, right? So at least to some extent, they can control more so than we can in the mouth. But I think you make an excellent point because let's hope that everything, in the breast explant surgery, that things heal well, but you're going to have scar formation, right? The scar formation is definitely going to influence energetic flow to the teeth and everything else on that energy meridian, right? So we have to think more broadly about the consequences of everything that occurs to us, the choices we make that we, inflict upon ourselves, such as our diet. It all influences our energy, right?
Yeah. Health is definitely a full body endeavor. It's about taking into consideration the entire person, and that's mind, body, and spirit. I think we've addressed a lot of that already. So, diving deeper, I want to talk about something. I'm sure many people have seen the controversial documentary Root Cause, which features opinions from doctors and dentists from around the world on the health effects of the root canal procedure specifically. They get into some other areas too, but I want to know from you, what about that documentary do you think created the major backlash that ended up getting it removed from Netflix?
Well, gosh, yeah, this is absolutely such a great point. And frankly, it was a well done movie. I've connected with the guy in Australia who made it. It's well written. It's a great documentation of his story. And it's very consistent with many people that I've, been fortunate enough to care for. I think that let's just take a look at a slightly different topic for just a second to appreciate dare we call it, political influence of large groups such as the American Dental Association, right? So up until maybe 10 years ago, the American Dental Association swore up and down, mercury is safe in your mouth. It's, it lasts forever, blah, blah, blah. Why are they were even taking people's dental licenses away for acknowledging the scientific fact that in fact people were being exposed to mercury by having them in their mouths. Interestingly enough pressure in science was finally presented that they now acknowledge, even you can find it on the ADA's website, that in fact, it is known that, constantly mercury vapor is being given off from silver mercury fillings, right? It's interesting how they've changed their tune. They've also stated that but we don't know that it's unsafe for people unless you're a pregnant woman or a child under 6, then you shouldn't have it, which is absolutely crazy. So you think about in dental schools in America and other places in the world, every dental student comes out of there having done root canals. We're being taught to just extend that drilling from the top of the tooth into the middle, go ahead and clean the whole thing out. And they're even specialists, right? They're specialists in the practice, endodontists, right? Doing root canals. And, no fault to them. I mean, they've been led down this path. I certainly learned how to do them in dental school and, learned to perfect them in continuing education and residency. And the problem is that the tooth itself, right? What we're used to looking at when we talk with each other and we look at each other's smiles, all we're seeing is the enamel, which is impervious to bacteria unless you get decay, right? But let's just take healthy enamel. The root surface of the tooth, on the other hand, which is the vast majority of the tooth, it's all porous like a sponge, right? It's called dentin, mostly made of collagen. And these pores are, somewhere on the order of 5 to 10 times wider in diameter than the bacteria that live under our gum line, right? So, you go and you drill a tooth out and you remove the nerve and now it's empty inside. It's void of everything, and you put your little root canal filling cone in there. It's now it's housed in a sponge that will absorb the bacteria that live underneath the gum line as long as it's in your mouth, right? And some studies have shown that it takes about 30 days for the tooth in its entirety to absorb anaerobic bacteria and become infected, which if you think about it, forget the science. If you just think about what are people expecting when they go in to have the root canal done? Oh, well, my pain's going to go away. It's, it should never hurt again, should be healthy. I mean, I just spent, $2,000, $3,000 on this tooth. Surely it must be able to last me a lifetime now, right? And unfortunately, there's so much that's not being shared about what potentially could happen and what is likely to happen with their health because of it, right? And I've kind of argued this fact with endodontists who have pinged me via Instagram. And it's interesting. I mean, so to answer your question, sorry, I got a little off track, but to answer your question with respect to why so much backlash, in America, more than 15 million root canals are going to be done this year.
Wow.
So that's, 41,000 roots per day. I mean,
a lot of money.
It's a lot of money. And it's also, I just think about, because this is how my spirit works, I think, at what point do you acknowledge that we're wrong, right? Oops, I think about in the time I've been out of dental school, that's getting close to 500 million root canals that have been done just in America, right? So I think about what are the long-term health ramifications of that? We don't know. For every, it's going to be different, certainly, but that's a lot of dental care, if you want to call it that, being done, that if we suddenly acknowledge the risks, the true risks that are associated with that. That's a lot of eating crow, so to speak.
Right.
And how do you address that with patients? I mean, my belief system is that human beings deserve and expect that we as healthcare providers would constantly be not only learning and growing, but also assessing the methodology of the past. Does it still hold true today? If so, why? And should we continue doing it the same way or change it?
Yeah, and true science is very much, I mean, really what it's all about is finding out where we're mistaken. Like, okay, where did we put something into science law, and then now we need to look at it again because we've come across new information that makes it incorrect. And I think the hardest thing humans do is come up against those dissonances and reassess, reframe, and move through it, because change is painful. We are averse to pain. So you're asking people to do a very difficult thing, but that's why, what you're doing is so powerful and important. And we're glad you're being a light in that regard. I wanted to ask you about how worried, my fear monitor is going up as I watch root cause. And as we have this conversation, I have a root canal in my mouth currently that I've had for years and years. My wisdom teeth have been removed years ago. And I'm sure the majority of people listening can also relate in that same way. So how worried do we need to be about the work that we have done in our, we've had done in our mouths with traditional dentistry, root canals and wisdom teeth and whatever else, mercury fillings and such, that could be potentially dangerous and toxic?
Yeah. So if it's all right with you, I might shift the word worried to concerned, but that's just personal preference. So I'll share a couple of stories that are very near and dear to me. So a few years back, when my brother moved to Texas, my father had been seeing my brother at his practice when he was here. And so my dad ended up coming back to me, and we did a three-dimensional cone beam scan. And my dad happened to have all 4 molars on his left side. They were all root canal, right? And when we did the cone beam scan, which thankfully it's a technology that allows us to move through teeth in 3 dimensions. So it's very detailed and allows us to see things that we cannot see 2-dimensionally. We noticed that he was having, severe bone loss around these dead teeth, which looking back, it's like, well, of course they're dead, right? I mean, it's the body's normal response to having dead tissue. And when we talked with him about these teeth that were absolutely asymptomatic to him, by the way, he had no clue. And when we talked about it, of course, his response was, well, how am I going to eat if we take those teeth out? Right. And I thought, well, that's a good question. What I can tell you is it's not good. And my advice is we get them out. And he says, well, let me think about it. Okay. Within the year that he was taking some time to think about it, he was diagnosed with non-Hodgkin's lymphoma of his left cervical chain of lymph nodes in his neck. And those are the lymph nodes that drain that part of the mouth. Wow. Right. So I'm thinking, well, where else would that infection be going when if it doesn't have a draining port, which kind of gross, but it happens, which he did not, that's where all that junk is going. So, and of course his oncologist, he went to see them first. He didn't even mention it to me until he'd seen his physician, his oncologist, and he calls up and says, hey, I got this problem in my neck. I wanted to let you know, and we have a treatment plan. I said, well, Dad, you understand your teeth are connected to that, right? So it really opened this opportunity to connect with his physicians where we could all work as a team and get out the source that was causing that. He's now missing all 4 of those molars. So, and he's chosen to go without them, right? I mean, it's possible to do that.
Yeah, that's a choice.
Yeah, I mean, part of it is that he just doesn't have a ton of bone remaining due to the periodontal issues he had prior to that. But, absolutely. I'd much rather be without a couple sets of teeth and not dying of cancer than focused on, well, I just got to keep those teeth so I can chew. So, that was a real awakening for me. So when we think about how worried should we be, I don't know if it's worried. I don't know if it's concerned. I think what I would encourage people to become is informed.
Yeah, aware, informed, what they want with that.
Even better. So I think, yes, thank you for that word, because aware, you have to be aware before you can become informed, right? And that's the beauty of what you're offering here and what I've been trying to share via Instagram and other social media methods is letting people know this is all accurate, scientific, documented information. It's just not being shared with you. So I encourage you to connect with us, connect with your dentist. Let's just all be asking more questions and, finding answers. Yeah. So yeah, it's an opportunity for awareness creation. How about that?
Yes, beautiful. And I'm going to have to, once we're done with this pandemic thing, get a flight over to you and maybe make a visit to your office if I can't find a dentist I can trust over here to
Absolutely.
what I got going on.
Yeah, it's amazing. I mean, probably a third to a half of all of our new patients now fly to see us, which is blessed. But it's wonderful because they can go back to their communities and share like, hey, 100%, this profession will not change until the people, who are supported by it become aware and ask for better, right?
Absolutely.
Yeah, simple truth.
Put their dollar, put their money where their mouth is, literally. Yeah.
So you brought up about how, metals ending up in our mouth, affect us. What would people experience if they did have mercury fillings or titanium implants?
That are negative, like a negative effect from them.
Yeah.
Absolutely. Well, so with mercury, and just short history lesson here, it's kind of appropriate timing because it's been just about 200 years since mercury fillings came on the market. So we'll start with mercury. I think it was called like the National Association of Dentists or something. It was the ADA of the time, which had a different name. When these came out, they knew that putting mercury in people's mouths was horribly unsafe, right? And in good conscience, they said, look, if you are to remain a member in good standing with our group, you won't put this in people's teeth. You'll do something else. And so the pro-mercury dentists founded the American Dental Association. It's what still exists today. And it caused the demise of the other one, right? Because it was just, you could not compete because people are unaware and, they were told it's a silver filling, right? You think, well, silver, I've got silver platters, silver spoons, or,
taking colloidal silver, we think silver is harmless.
Right. And silver has absolutely clinical benefits. Mercury, not so much. Okay. No neurotoxin. And it's interesting when we look at a lot of the European Union nations who have said, look, we're back then, yes, it was what we had. Today we have better materials.
Well, we know mercury, even just coming from the food we eat, the fish we consume and that type of thing is poisonous at a certain degree.
Absolutely. Well, one of my favorite examples is if one of the lights in my office, like the compact fluorescent lights, were to fall on the ground,
right,
which has like 0.5% the amount of mercury as one filling, let alone 10, right? One filling. Well, we've got to air out the place. You got to get out, get your hazmat suit on and clean it all. It's like, really? And we're putting this stuff
in our mouth. Yeah.
I think the average single filling in a person's mouth has approximately a half a gram of mercury.
Wow.
A half a gram, right? And the CDC and the World Health Organization would, if you read their websites, they will say there is no known safe level of mercury in the body. And we're putting a half a gram of filling. Like, that's insane. Now, I will say most people, or most dentists that I know, don't choose to place it anymore, thankfully. But statistically, we know that still half of the dentists in America do. And that's a lot of fillings, right? That's a lot of mercury.
And so it's a cheaper option. Is that why they're keeping it?
It's two things. It's cheap as all get out, and it is relatively technique insensitive, meaning as long as you can cut a dovetailed shape into a tooth, meaning it has to be wider at the base than it is at the top, because mercury fillings don't stick to teeth. You have to lock them in. And you can imagine all the healthy tooth structure you have to cut away to do that, right?
I mean, when they pop out, we're just swallowing them, and that's a whole nother drama.
Well, yeah, frankly, that swallowing a whole chunk might be better because you'll pass it in 24 hours, right? I think God willing, usually you do. It's that constant day-to-day low-level exposure
leaching
that's unsafe, right? And who doesn't get up in the morning and have a hot tea,
right?
Or even a hot piece of pizza or a bowl of noodles? You're warming or grinding your teeth. All these things that create friction and or just environmental warming. You're elevating your mercury vapor exposure, right? So that's mercury, not good. And so we talked about it's not good putting in your mouth. We want to remove it safely, so find a smart certified dentist. The other thing is that if you've had these in your mouth, and some people have for 10 years, 20 years, 50 years, that's an awful lot of exposure where your body, especially when we breathe it in, which we do frequently, that gets absorbed by mostly fat-based tissue. And you think about what's your brain made out of,
right?
Mostly fat. So there are ways to detox your body from it. And I've certainly seen some approaches which are kind of like run and gun, like let's dump it all. I mean, that's not the way your body absorbed it. I would not suggest doing that approach because you're going to overwhelm your body. So we try to find for our patients who are in that position, a good naturopath or a good nutritional therapist or somebody who's savvy with lifetime detox approaches like dietary modifications that will help your body release it over time. Yeah. And some people find it more preferentially than others, right? So as an interesting tale, when I was in my integrative medical dental training over the last couple of years, we did a Mercury test where it was hair, which, a little tough for me, but hair test, urine, and blood. And my test came back very low. Now, if you think about the fact that I'm exposed to mercury more so than your average individual, and I don't have it in my mouth, it speaks to the fact that I'm likely binding it well, which is why you don't see it being expressed out. Some other people, like one of my hygienists, Mara, who was studying with me, she was showing higher levels, which in some ways it's a good thing to find because it says, well, your body's getting rid of it, right? So that's good. A couple other metals I would share with you. Let's talk about dental crowns, right? Because one of the comments or the phrases that people often hear when you go to the dentist, right? Let's say you've had that mercury filling in your tooth forever. Oh, you need a crown, right? Crack's gotten big because they ground the heck out of the tooth. You need a crown, which I would say nobody needs a crown. People don't need teeth, but they're nice to have. So historically, like when I was in dental school more than 20 years ago, we did not have all porcelain crowns. They just really, they existed. They just weren't ready for market yet. So all porcelain crowns that we placed back then had a metal substructure. And because of kind of the unsightliness of those, we used to grind the tooth down below the gum line. And when we glue it onto the tooth, the edge of that crown would be tucked underneath the gum. Now, what's interesting is that metal substructure, it's not like solid gold that your body's going to be like, oh, cool, gold, we like gold. There would be like palladium, cobalt, some other metals within the alloy that you may or may not be sensitive to, right? No, but very few dentists are testing to find out
your sensitivity
to these metals before we stick them in your body.
Right.
So that's a concern, which then brings me to, thinking about really putting in your body, titanium implants.
Yeah, that's what I was thinking.
Now, I want to say and acknowledge that, titanium implants have been available for over 40 years, and many people have been well served by them. Titanium can work very well for you if you're not sensitive to the alloy, right? And I'm kind of sensitive to the subject because, when I went to have a new knee put in, they didn't make porcelain knees.
Right.
So sometimes it's the best option that you have. But if you are sensitive to anything within that titanium alloy, such as, and I think the most common component would be nickel, right? So many people are, especially women, they would be aware that, well, I'm nickel sensitive because every time I put in these cheap earrings, my swells up. Not as many men probably are as exposed, generally speaking. But I have seen patients, mostly women so far, where when we put in an implant, and this is before we had zirconia implants available, where the body didn't reject the implant, but we started seeing symptoms like rashes or hives or tinnitus in the ears. I've seen some interesting things from the disruption that we caused by putting in a metal to which they were sensitive, and we just didn't know.
Not to mention the way that metal plays in the energy flow on your body,
Exactly.
You talk about, if we want to get into the world of it, when you talk about aura readings and that type of thing, when you have a magnet on or something metal on, you see the chunk in your aura, you see the place where the energy is not flowing properly.
It's amazing. It's just amazing. All this stuff, probably why I'm so passionate about it. My mind is blown every day. I will share that zirconia implants have been on the market for about 10 years now. And again, there's nothing that's a panacea.
Right.
Oh, this just solves all of our problems, right?
Forever. Yeah.
If you've got decay, no problem. We'll just take your teeth out and give you zirconia implants. It's not like that. But I will say, I have seen for most patients for whom we've used them, very good results. Tissue loves it, right? It's a ceramic, so it's not metallurgically active. It doesn't carry a current. So, and it's on top of all that, it's white, right? So coming out of your gum tissue, it tends to look better than a metal post. So that's kind of a benefit.
So that is our best bet thus far, as having a tooth in that place if you have something that needs to be removed.
I don't generally say best. I would say it is certainly the most biologically compatible, but best is a very subjective term. So let's say it was your very front tooth that had a root canal. We decided to take it out. We would have to consider, like, how are we going to create the very best shape possible? And sometimes the best shape possible is only attainable using technology currently available with a titanium implant, just because of the nature of how it all works. Now, that being said, next year, 5 years, 10 years down the road, I mean, I expect we're going to see improvements in the zirconia world.
Yeah.
The titanium implant world has just had so much more time to do R&D stuff.
Mhm.
So it's all coming. I'm just glad that we have options. And I will say this, like, handful of months ago, my wife had a root canal on her upper right canine, which was feeling fine. Everything was well. However, it was on the energy meridian of her liver, and her liver enzymes kept looking, getting more and more out of whack based on her blood work with her naturopath. So ultimately, she decided, I just don't want to mess with it. Let's take it out. So before we put an implant in, I had her go to see a healthcare provider to do some muscle testing. And I had them do muscle testing for 7 different implants, 4 of which were titanium, 3 of which were zirconia. And interestingly enough, she tested well for 2 zirconia and 2 titanium. So we ended up choosing the same titanium that she has on her other canine, which went bad a decade ago. My poor wife, right? But it's nice to know that you can ask the body's energy field whether something is compatible or not. And that's
Right.
not my area of expertise. I do refer out for that currently, but it's absolutely something I so highly value doing with our patients.
Yeah. And again, as we're talking about some of these alternative medicine routes and talking about someone who's able to muscle test and read that type of thing, people, I'm sure there's lots of skeptics. I'm always a skeptic, and I think we all should be to some degree, are going, that doesn't sound like real science. But I just, and if you're listening and you're feeling that way, I'd invite you to do your own research, see what you come up with, because that's really the only way you're going to get to decide what is true for you.
Absolutely.
Yeah.
So we have some magic mob questions, and you kind of already covered this first one, but maybe you can go into specifics. So Cassandra on Instagram asks, how does our diet and gut health affect our oral health?
Oh, so good. So good. So think of like it 100%, it's almost everything. Like when Ron and I started our training in integrative biological care, we were given 2 books, one which was called Power versus Force, which is a phenomenal book, just kind of talking about the energy of the universe.
Okay.
And our need to appreciate that if we want to help people. The
Yeah.
other was called Gut by Dr. Julia Enders, who's a German physician, younger physician. Phenomenal book. It's so good, we actually bought a copy for every one of our teammates. We all went together. We all book reviewed it together. So one of the common sayings that we had in this integrative college was, you got to poop good to look good.
Yeah,
Right?
so true. We call ourselves Pactivists out here on the show. It's poop and period activists. All about having a good menstrual flow and good pooping habits.
It's your body saying it's working.
Yeah.
I mean,
Detoxability.
Absolutely. As much as it makes me chuckle, it's so true. So when I think about that learning process, how appropriate that we started with gut health, right? So, and the mouth, as underappreciated as it might be, it is the opening to the whole gut tract, right? So, and oftentimes, depending on what a person's eating or sucking on or whatever, sometimes things will spend a lot of time in the mouth. So if there's something overly processed or sweet or acidic, or, I mean, all these things have an external influence on the teeth themselves. But then let's think about, we chomp, 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 chomp. Hopefully we have good saliva. We mix our food with our salivary enzymes. It starts going down our GI tract. Ultimately, we hope to absorb the nutrients, which then get into our bloodstream and then impact our teeth internally, right? So we have little blood vessels and veins and nerves and lymphatic vessels and all that inside every tooth, which is kind of magic, but there's always this positive pressure within each tooth. I mean, we know they're alive, right? How many of us have bitten into cold ice cream or something?
Right.
It's like, I mean, that's just the teeth saying, I'm alive in here. There's vital living tissue that constantly has a positive pressure of outward flow. And even more underappreciated is the quality of our saliva, which is a distillate from our own blood. So if we think about like, if our blood health isn't great because we're not eating well, because we have a nutrient deficient diet, how on earth are we ever going to have saliva that's of good quality to help us digest our foods properly? So it's a loop.
Absolutely. And that really resonates with me. I know that when I had a really shitty diet growing up, being in school, eating whatever they're feeding us in school, and just not having any education on how to eat and nutrition and that. And my family, the family I come from, didn't either. So of course I was putting whatever tasted good in my mouth. Well, not only did my digestive tract, my ability to detox poop suffer, but also I had cavities every time I would go to the dentist. And my saliva I was brushing my teeth regularly. I was flat, all the things you're supposed to be doing, but my saliva did not have what it needed in order to fight off, the decay process. So,
and it's such a catch-22, right? Because the stuff you're putting into the mouth is, negatively influencing you. And then when it comes back around through the saliva and the blood flow, it's also not helping you. I mean, it's so, of course, you were probably hearing, I'm imagining, when you'd go to the dentist, like, you need to brush and floss more.
No, they were saying, well, because they could tell my gum health was on par as far as like I wasn't, bleeding during my hygienist appointments and stuff like that. But it was, well, you just have soft teeth and you're always, I remember a dentist telling me probably in the next 10 years, you'll have all your teeth will be root canals because you just have soft teeth. I remember like being like, God, my genes are terrible, thinking that it was that. And as soon as I changed my diet and started focusing on nutrition, not have a cavity since.
Because I've never even heard the term soft teeth.
Yeah. It is a term that is used and it's absolute baloney. And I will say this. I mean, there are some very infrequent genetic abnormalities where the cells that are supposed to do the job of manufacturing enamel as your teeth develop just don't work properly. And that's like the total one-off, I can't tell you how many people I've met that says, well, like they come in believing, which presents a whole different level of energetic influence, right? Our belief systems that, well, I've just got bad genetics and my teeth are soft. It's like, tell me about your diet. And my favorite conversation is, when was the last time you recall having a cavity, right? And if they say, well, geez, it's probably been 25 years. I say, well, about how long has it been since, you've been on a relatively healthful diet? It's been about 25 years. Like, okay, maybe it wasn't soft teeth after all, right? So.
Yeah. And I do remember, this is slightly off topic, but I remember when I was younger being told I have deep grooves in my teeth, like the insides of my molars have deep grooves and that I would need to fill all of them just as a precautionary measure.
Yeah.
Luckily I didn't, but that would mean they would shave down my teeth, fill something in there and create a different slope, which would change my jaw set and everything else. It's just incredible the things that are getting sold to us. And literally that's the word, is sold. This is about making money a lot of the time.
Yeah, sadly, especially I think that Jade was bringing up the issue earlier about insurance connectivity. And, sadly, we are seeing more and more dentists coming out of dental school and going into corporate dental environments where the idea is turn and burn dentistry. No time it's the same thing. It's moving in the same model as healthcare, like 5 minutes or 8 minutes a patient, and you cannot facilitate optimal healthcare in that environment. But that's the direction that things are moving, which is horrifying to me as somebody who's come out and worked my butt off to create an environment where all we do is facilitate health.
Right.
But it's something we have to be aware of because, again, and I think, Mercedes, you were mentioning something about we choose with our dollars, right? When our employers are purchasing a healthcare plan, we have a say, right? That's the point at which, if they're going to provide benefits, stand up, make your voice heard, say, I would much rather have that $1,000 a year in my own pocket to spend how I would prefer to do it, rather than you directing me to some clinic where nobody cares about my health.
Yeah, absolutely. That's it's a hard pill to swallow, I think, for so many people, because we're being sold insurance on every corner and being told that that's what we need and we're not safe without it. That's what we think. And it's just not true.
No.
So what diets do you see the best results with in your patients when it comes to overall oral health?
Yeah. So I'll share a few generalities and then maybe mention a book that I think would be perfect for every listener. So it kind of boils down to like a diet that is more whole foods based, and staying away from processed junk. I mean, that's kind of the simplistic version. The book I'm thinking of, there's a book called The Dental Diet, written by a guy named Dr. Stephen Lin, who is an Australian dentist. And he reviews the research and work done by a guy named Dr. Weston Price. And for those people who are like nutrition savvy, and they would probably know who Dr. Weston Price was. But Dr. Price did a lot of research throughout the world looking at cultures where in the native culture, like people just didn't develop tooth decay. And they also coincidentally had these beautifully broad arches, plenty of space for their teeth to fall in line. And it didn't matter if they were from Alaska or the Andes or whatever. If they were eating a non-processed native diet, they would develop these healthy arches and teeth that didn't decay. Interestingly enough, he also noticed that those in the same communities who were exposed to the processed Western diet, this is like back in the 1910s, 1920s, things would all start falling apart. The teeth would decay. The arches within a generation would be shrunken, and there wouldn't be enough room for teeth. And part of that's nutritional. Part of that is also functional, like how we use our jaws, our tongue, to chew food. So anyways, Dr. Lin does a phenomenal job reviewing Dr. Price's work and makes a lot of practical recommendations, particularly for those people who are wanting to make that shift out of processed food-based diet into more, whether you're buying it at Whole Foods or making it at home. And probably the latter third or quarter of his book is all recipes, right?
Mm-hmm.
So it's kind of the Whole Foods diet. It's hard to go wrong. You also have to use common sense. I mean, I've met a lot of folks who, they come in and they share that, I'm a green smoothie junkie and, yada, yada. And we find out they're still showing signs of risk, right? Maybe part of what we do is we actually swab clean teeth and look at the bacteria that are living on them and those sorts of things. And if we find that their acidic risk is still high, we have to dig deeper. Some of these folks are like, well, I mean, I've been sipping on lemon water all day for the last 3 years. And you're like, well,
I have.
Right? And I mean, so we think about is your saliva able to constantly neutralize the acids to which we're exposing our mouth, right? So if you're a lemon juice and, apple cider vinegar type of person, and you just, put it down quickly, very little length of time that you're exposing your mouth, you're probably not going to have problems, right? But if you constantly sip on it and there's just more acid, ultimately your teeth will lose that battle, if that makes sense. Or it could be kombucha or, what have you. There's a lot of different sources. But anything acidic or sweet, if it's done over time, consistently, like a lot of frequency, that usually adds up to high risk for tooth breakdown. Right. So I tell people, even if they're like a Diet Coke drinker, God forbid, if you're not ready to give up the Diet Coke, okay, is it possible to shrink that down to 15 minutes instead of 3 hours? So it's not just what we eat, but how we eat it that makes a huge difference.
Yeah. And I think such a big piece of that, and I'm sure it speaks to it in that book you're mentioning, because I think this is something what Dr. Weston Price speaks to in his other work, is focusing on our microbiome, focusing on the variety of colonies of bacteria that we have in our gut, because that's going to relate to what's in our saliva and, the ability for us to break down food properly so that we don't have the acid from our stomach coming up into our, all kinds of things that are related
Right.
there. So focusing on the feeding a variety of different bacteria, gut bugs, that I call them, is a huge part of that practice. And so I think that means that every diet is going to be different person to person because your bacteria set is different person to person. So
true. And I think you just brought up a point, which I just have to touch on it because it's so significant, in this crazy Western medical model that we are exposed to, when the first solution to, acid reflux is, well, let's turn off your acid. How on earth will you ever digest your proteins?
right.
If you don't have acid in your stomach, which then throws off the microbiome, which, you see it like the snowballs rolling down the hill. And proton pump inhibitors and H2 blockers and antacids and such are it's ridiculous the level at which those things are being used on a daily basis.
It's frightening that people go to their doctor, and I was one of them. So, don't
Sure.
feel shame for this if you're listening and feel this way, but go to their doctor, usually their Western doctor, and get prescribed whatever it is for their heartburn, for instance, or indigestion or ulcers or whatever they got going on in there, and go home and take it. And they don't look into it. They don't figure out what are the side effects here? What is this actually doing? How does this medicine actually work on my body? And if we did just a little bit of research, we would find out that these are not all what they're cracked up to be. Maybe they'll get you through the day, but long term, you're actually usually doing more damage in a lot of these cases than good. I think that's a huge one, though. I'm glad you stayed on it a little bit, because figuring out the amount of acid we have in our stomach in order to digest our food, which needs to be extremely acidic, is so freaking important. And it's the number one thing people are not just neglecting, but doing the opposite. They're putting an antacid in there and creating a bigger problem.
Yeah, it's amazing.
Whoever's listening, I'd invite you to look into that. You could listen to our episode with Dr. Rob, which we get into that.
Yeah. So one more Magic Mob question. Keith from Instagram asks, when it comes to toothpaste, what are the ingredients we should make sure are excluded or included?
Well, I'm going to provide a resource because there's just too many options. And I came to this, you guys probably are familiar with the Environmental Working Group. They have an app called, the app is called Healthy Living. And I love this app, right? You load up the app, you go to your, natural store or, CVS or whatever, right? And you pull up the toothpaste, you scan the barcode, and it gives you a relative toxicity number 1 through 10. 1 would be safe, right? And as you can imagine, there aren't a lot of, certified safe products out there. But, certainly like the things if you see it marketed on television, like, Listerine, Scope, Crest, blah, blah, whatever, whitening, whatever, probably not safe, right? The amount of chemicals, especially like the triclosan that was out in the Colgate stuff 20 years ago. I mean, we find that these things that are bacterially inhibitory, it's not like it's limited. It's just going to treat the bacteria on your gums, right? I mean, it treats the bacteria everywhere in your mouth. And some of those bacteria, we need, right?
For sure.
We're creating a disruption or creating a dysbiosis in our mouth. You can be guaranteed that's going to go downstream. So anyway, I just offer that up, to use the app. I mean, I would share personally, I use the Jason brand Power White or Power Smile peppermint for 2 reasons. 1, it's super low on the app, so the risk factor is low, and it tastes great. I mean, like if it tastes like garbage, and believe me, I've tried a lot of stuff, bentonite clay, this and that, sea salt, it seems like you rub it on a steak or something, not for your teeth, but it's got to taste good in order for most people to use it. And I also think about like, what's the significance of toothpaste when we're exposed to it for less than 5 minutes a day?
Yeah.
Right. So really it's like, I encourage people to think about what's the quality of my saliva and how do I create it through a great diet? How do I make sure that I'm absorbing well, through chewing effectively, through not messing with my acidic, levels in my stomach, all these things, right? And for some of us, and I work with a clinical nutritionist myself, I find it to be hugely valuable in terms of like how to tweak my supplementation so that I'm optimizing my health. I would encourage people to do that because, why not, right? Why not optimize it if we can?
What are your thoughts on like charcoal toothpaste or remineralizing toothpaste? Are either of those something you recommend? Well,
so it goes along the same lines of like, if you're only exposed to it for 5 minutes a day, well, let's use this because this is a common scenario that I'm exposed to. Someone comes in sipping a water bottle with lemons in it. So I know that there's acidic exposure constantly. They're like, I've been using this remineralizing toothpaste, and I asked them jokingly, because why not have some fun with it? Like, are you using the toothpaste more frequently than you're sipping on your water? They're like, well, no, I use it once and twice a day. It's like, okay, so we have to think of the whole picture.
So it's like you're stripping every time you're sipping. You're stripping and you're sipping and stripping, and you're only remineralizing twice a day, but the whole rest of the day you're stripping off layers and layers.
Yeah, I mean
But if you're going to use a toothpaste, might as well use one that's beneficial.
Well, certainly, and I don't think that exposing yourself to chemicals that we know have toxic effects, like there's no sense in that. Which is like, I don't need to be an expert in toothpaste. I just know what app to use. Because the Environmental Working Group has way more scientists that are a lot smarter at that stuff than me. So I just kind of use that, and you can use it for bar soap. You can use it for
Mhm.
hair shampoo and conditioner, all this. I mean, again, as a bald guy, I don't need that, but my needs are simple, toothpaste. So yeah, it's a great app.
Okay. And before we move on to our staple questions, I did want to kind of circle back on something you mentioned, which was the 3D cone beam imaging x-ray, which is what you guys use to just first diagnose what's going on in our mouths, right? Can you go into how we go about detecting stealth infections and what's going on with our teeth in an office like yours?
Absolutely. So I would make some general statements, which I believe I can certainly support them scientifically as well as my own experience. One is that if you have had holes cut into your teeth, or the entire tooth cut down and a crown put on your tooth, or root canals in your teeth, like anything that's modified the natural structure of the tooth, you now have a union between something that is not you and you, right? So let's take a crown, for instance. When that gets glued onto the tooth, again, you take this super hard crown and glue it onto a substructure, which is 70% collagen, and then you compress it over time. You will always be experiencing slight leakage under that crown. It's not, I mean, all dentists know that. But we observe it when we cut the old crown off and we see like, ew, people will say like, oh, it stinks, right? I mean, that's so gross, but it just is what it is. So if you've had any of these things, right, or even implants that have not been well maintained, these environments will house bacteria, oftentimes pathogenic types, and you have to go looking for them. But if you don't understand, like let's say, like imagine me 15, 20 years ago, if I didn't understand at that time, which I didn't, that root canals could negatively influence your health, that, chronic mild infection around implants is going to negatively affect your health, I would just be patting you on the back and telling you, oh, everything looks good. So the ability to determine where you do have stealth infection has a lot to do with the experience and open-mindedness of the provider, right? And there's lots of dentists out there that are on this wavelength or are coherent with what I'm sharing today, but it does take a little effort to find them because, it's going against the grain, right? This isn't the traditional stuff.
Yeah, and I was just going to say, regarding wisdom teeth, you brought up a bunch about wisdom teeth, but do you recommend people don't remove them at all, or what do you recommend the process is there?
Yeah, that's a good question. I mean, I would say that if you have the opportunity to develop room for them, which starts when the day you're born, right? Like the significance of breastfeeding cannot be understated for so many reasons. But from a dental health standpoint and like a skeletal development standpoint, that pushing up of the tongue, which helps broaden out your arches, is partly what helps you create space for these teeth, 20 years later.
Wow.
So if we just, go, this wasn't working, or, nursing was hard, or we go with a bottle and that's all they're exposed to, it absolutely will modify the shape of their dental arches.
So just to clarify on that, because I have never heard about that before, is it the suction that the kid has to create in order to get the milk to come from the mother that's not happening when they're having a bottle that's creating what you're talking about here?
Right. So, I mean, I'm not a breastfeeding expert, but I have two daughters, my wife had two children at one point in time. So, if we look at the dynamic functioning of what a newborn or a young baby has to do to latch onto a breast, how they use all the muscles of the mouth and how the tongue has to, work to latch on and create the rhythmic motion to express the milk from the breast, like that's a very complicated system, right? But we're also designed to do it for many reasons.
Yeah.
So if you think about how the dynamics of a bottle works, it's very different. It's generally speaking a lot more passive, which means the child tends to like suck around that fake nipple and the milk will come in way more passively. So if the tongue never has to push up and push out on that upper arch of the jaw, it will end up, you've seen the look like when kids kind of suck on a thumb or a finger, and the arch takes the form literally of the fingers that have been in there over time.
Wow.
Right? Form follows function. So if the function is I'm latched onto, a breast that's engorged, which is large and all this, like you have to fit a lot in your mouth and you have to do work to make that happen.
I don't have any molars. I mean, wisdom teeth. I don't have any wisdom teeth, and they didn't show up in the X-ray as being in my gums either. So
Congratulations.
Yeah. What about something a little more simpler though, like people who have chronic bad breath? What does that typically stem from?
Wait, hold on, wait. Before we go there, we didn't finish the wisdom teeth piece just about
That's
what do
right.
we do with the wisdom teeth. Jade, will you ask that again when we do that so that we can edit that back? I just want to make sure we get that piece in.
Oh, absolutely. No, I think that, so yes, if you can keep them, there are a lot of good reasons to keep your wisdom teeth. I absolutely see people every day where, you know, like we see a number of new patients a day where you can tell those wisdom teeth are either never coming in because they're sideways or we don't even worry about it, right? Like, you know, it's not a concern. If I don't anticipate them needing to or coming out on their own in a weird angle, just leave it be, right? But sometimes they will present, and this can be quite frequently, honestly, they present in weird angles where maybe a little part of the tooth sticks through. And because the gums that are around the head of that tooth make kind of like a hoodie, for lack of a better term, if you get food that gets trapped down there and that creates an infection, you know, now we've got a big burning fire to put out, and that's not good. So sometimes we may, you know, consider like, now, in this case, it's going to make more sense to take them out. The trick is if they don't heal effectively, which, as I mentioned earlier, I mean, some studies show that as many as 75% of those extraction sites will trap infection inside the bone, which is not a good deal. You know, that may be affecting your health for, let's say you have them taken out and you're 18 and you're 78 and you can't understand why you've had, you know, hypertension for 40 years, but you've been treating it with medicine, which is also affecting your health otherwise. Like, we're just never thinking about what was the cause.
Right.
So there are ways to prevent it. Absolutely.
Yeah. Okay. Thank you for that.
I'm just going to move my previous question to here. So what about chronic bad breath?
Ooh, yeah. So as you can imagine, you know, there are a lot of potential sources for bad breath. I would say the most common that I see are periodontal neglect. And what I mean by that is, let's say, you know, person feels like I'm young, I'm healthy, you know, I'm busy in my life, I'm doing stuff like, you know, I don't notice my gums bleed that often when I brush. You know, I don't even floss because, you know, when I do floss, it tends to bleed too much. So they just go on about their life for 3 years, 5 years, 10 years. All this time they're building up tartar. And the analogy I typically use is, let's imagine you owned a boat. We went and we put it in the river down here and we left it for 10 years, right? We never took it out of the water. We never cleaned it off. What do you imagine would be growing under the surface, right? We go, oh yeah, probably some barnacles and what have you. Well, that's what happens in the mouth, right? I mean, it's the plaque that builds up when we don't have professional cleanings. And let's be honest, some people are better served by cleanings than others. Some people don't build up much tartar, right?
And some it's just not in budget for them. And, you know, we don't have free healthcare. So
yeah, absolutely. You know, but if it builds up, it is like a snowball rolling down a hill, right? So given more and more time, it becomes more pathogenic. It tends to stink more. And usually, if you're noticing somebody that has some funky breath, you know, I mean, I like to use technical terms like funky breath, you know, you go, you know, what do their gums look like when they laugh and smile? And usually you can spot it from a mile away. They tend to be red and inflamed. And another source, which is fairly common, would be like tonsil stones. So, you know, think about if somebody is chronically mildly inflamed, maybe it's dietarily based, right? They're exposed to stuff that they're sensitive to and they're just not aware of it. So their body's in this kind of chronically hyperinflamed state. And those tonsils are always a little bit bulbous. Those crypts in there can build up like very dense, bacterially laden. It's almost like tartar, but in your tonsils, right? And they can stink. So, I mean, it could be that. Trick is like just going to see a dentist to take a look and figure out why.
Can you clean that type of thing out, or what do you guys do in that case with the tonsils?
Yeah, absolutely. I mean, with the teeth, there are a lot of different methods. Traditionally, what a dentist would say, and some of these phrases, by the way, are just horrible. But, you know, you go to a traditional office, you've got tartar built up and you haven't been in a few years. They'll tell you need scaling and root planing, which doesn't sound good to anybody.
Wow.
So usually you run, right? You know,
yeah.
You know, let me think on that. You know, let me talk to my husband and I'll get back to you. And then you never come back. So the ways that we go about addressing that in our practice typically would be to use some type of oxidative process first. So we might use like some customized tray systems. The ones we use are called Perio Protect trays. And imagine being able to put trays over your teeth that housed like a hydrogen peroxide gel, which start to break down the tartar chemically, right? Or we might use some rinses that have like oxidized saline, something that will oxidize that tartar structure so that it becomes much easier for us to remove with ultrasonic instruments. Additionally, a huge part of our practice is the utilization of dental laser technology. So, I mean, that was probably the first technology I got into back in 2002 was dental lasers. And simply because it targets the stuff we don't want and it respects the health of the stuff we want to keep, right? So it's like, well, might as well use that. So whenever we're doing gum therapy, we're going to utilize lasers because it's less invasive and more effective. So there are absolutely techniques that help make it comfortable. I mean, gosh, for almost anybody, we can come up with a solution that'll fit their budget. So there are ways. It's a matter of just, seeking it out. And as we know, I mean, gum health is paramount to good cardiovascular health.
Right.
So we have inflammation here. We have inflammation here.
Yeah. And again, it just sounds like so much of it starts with the gut and with what we're eating, what we're putting in our mouth, whether that's even cigarettes and
absolutely.
Yeah.
Absolutely.
Okay. We got work to do, fam. All right. So there's a few short questions we like to ask everyone who comes on the show. First off, if you could hug your younger self right now, what would you say?
So there's probably a lot of things I could think to say. The thing that resonates with my heart is I would probably tell my younger self just very simply that I love you.
Yeah. How old? I mean, we all need to hear that probably every day, but how old were you envisioning when that question came to you?
I'm seeing like my high school and college self.
Okay.
If you could have the whole world read one book, which would it be?
Ooh.
You've given us already a lot.
Yeah.
A lot.
So good. So, okay. So you'll find like when I find a good book, like I tend to talk about it a lot and I tend to bring it back to my team.
Yeah.
So, I work with 11 other human beings who are phenomenal human beings. I mean, I'm so blessed. It's taken me 20 years to build this team, but it's amazing. Like the work we get to do. And so I like to bring them along with me in my learning journey.
Yeah.
So interestingly, my lead hygienist and I, when we were studying with the ACIMD, we were in the New Jersey airport waiting to fly home. And like, I was kind of looking for a book to read. And she says, hey, check out this book. I read it a while ago. It's called The 4 Agreements. So I look it up on Amazon or whatever. Have you read that book?
Yeah, we actually had on Don Miguel Ruiz Jr. on the show. And he's, and also Heather Ashamara, who's both their work is all based in the 4 Agreement, that Toltec wisdom.
Yeah.
So you know more than I do. You've interviewed them. But honestly, those 4 agreements, which of course, as soon as I got off the plane and went home, I had to tell my wife and daughters about this, like how amazing it was. But again, kind of as a student of psychology, as my first professional endeavor, I appreciated what he shared so much. And it's become part of our ethos and our communication style here in the practice. I think if everybody were to read the 4 agreements, like what a magical world of communication we would start to embody.
Yeah. If we could really...
If we're able to apply it.
Yeah, apply it. We read a lot of things. What do we apply? But no, it's such a beautiful foundational just piece of wisdom. Those 4 agreements are really the core of what we need to move from as humans in communicating with other humans. And that's what we are. We're social beings.
Well, I've started to find myself even like if I'm having kind of that, that energetic disturbance you start to have in your core.
Yeah.
Where you're like, ooh, I'm not feeling my good vibe right now. I've been working on training myself to ask like, all right, which of the agreements am I not, in touch with right now? And it might be that I'm assuming something. Mm-hmm. And as soon as I can objectify that, it's like, oh, I can let it go.
Yeah.
Which is it's so powerful.
That's really powerful. I needed to hear that today. So thank you for that reminder.
Absolutely.
If you could whisper one phrase to everyone on the planet, what would it be?
I would whisper, what a concept, right? If I could whisper one thing to every person on the planet, it would be that God loves you and that you were designed for a purpose. And I'm not here to define what, God or the, power of the universe means for any other person. It's just to know that you are loved. If we all felt that in our hearts every morning when we woke up, I think how we approach life and how we approach other people's and the ways in which we desire to be connected with other human beings would be so different. Maybe we wouldn't have to have our way be the only way. I think there would be some power in that.
Yeah.
Yeah, absolutely.
Before we let you go, where can people find you online?
Okay. Thank you for allowing me the opportunity to share that. So my website is blodgettdentalcare.com. There's a lot of good information there. We just launched our Ask BDC platform. So, if you want to ask us questions, that's a good place to find us. If I could ask everybody who is going to listen to this podcast to please follow me on Instagram. My handle is @BlodgettDentalCare.
You put out some really great information there too. I enjoy following you.
Thank you so much.
That's how we found you.
Thank you. It seriously, it has become this was the flukiest thing that I never would have imagined, but I spend so much time, putting together people's stories of health transformation and also sharing information that is it's all out there, but we as dentists don't go looking in journals of toxicology and all this stuff for information, right? So the other thing I would ask people to do is once you're following us, please share our handle with everybody you know. Because as we talked about earlier, until the general public becomes aware of the fact that what has been done in their mouths for many people is negatively impacting their health, they would never know to ask for something different. So, and then the same thing is true on Facebook. It's, just look under Blodgett Dental Care on Facebook. Yeah.
Beautiful.
Awesome. Thank you so much.
We really appreciate the work you're doing in bringing light to a subject that, again, is not easy for people to look at because we've been taught a whole different direction for all the years of our lives, most of us anyway. So I'm just so glad to have been able to talk to someone today who is doing that work. It's got to be tough, but it is definitely brought a light to Jade in my life. And we're just really proud to know you. So thank you.
Thank you so much.
Absolutely. Should you ever want to, chew the fat of oral health care and systemic connection again, please reach out. This has been a true pleasure, and I'm just so grateful for the work that you're doing.
Thank you.
Thank you.
We will. I'm going to set up an appointment as soon as we get out of this pandemic to come. We'll figure that out.
Yay.
Thank you.
All right. So we will send you, of course, let you know exactly when this is going to air, and we'll send you the promos that we make from this video. And maybe if we do get to make it into the full YouTube video, we'll send you that link as well. All that good stuff.
Thank you so much.
Keep up the great work that you're doing. You two are awesome.
Thank you. We appreciate it.
We'll talk to you soon.
All right.
Bye.
Bye.
All right.
I feel
that
like
was a lot of information on oral health.
I know that was extensive, but hey, you know what? That's what we're doing here on the show, is trying to get informed on stuff that we just aren't thinking about that could potentially be the most positive influence on our health.
And I know we both have magic tricks on oral health, or at least related to it. So what's yours?
So mine is it's pretty simple. Get a water pick. So you guys may have seen what a water pick is. It's just this little tiny, like I want to call it like a dental instrument, but it's hooked up to a water source. You can get one that goes on your counter in your bathroom, and you put some water in and it pumps it out in a high velocity. So it's kind of like you're pressure washing your gums with it. And what it does is it pushes all the gunk that's in your gum line that's really hard to get to with a toothbrush or flossing. It pushes that all out of underneath your gums. And the little perk there too is if you get one that is for your shower. So I have one that actually hooks into my shower, and you have to, you'll have to follow the directions. I think I bought mine on Amazon for like $40, something like that.
Yeah.
But you basically connect it to your shower head, and there'll be a little valve that you turn on and off so that it pushes the water through the line for the pick. That way, when you're spraying all this gunk out of your gums, it doesn't matter where it goes. It doesn't go all over the mirror or anything. It goes in your shower.
Yeah.
So it's not a big deal. And for me, it has been a huge piece of my oral hygiene, a big increase for me there. And I know, Jade, you were talking about, worrying about chronic bad breath and things like that when people are dealing with that issue. I think this is a critical piece of that, because like Dr. Blodgett was saying, we get stuff stuck in our gums. We get this tartar buildup. So I think a water pick is a really good tool. It does not replace a dentist by any means. It does not replace a biological dentist, but it does give you some assistance in cleaning out the bacteria that might be hiding where you don't want them.
I had never heard of one, so I'm excited to purchase one. My magic trick it's slightly related. I because coffee stains our teeth, and then we, feel
And
like and then we feel the need to whiten our teeth because we've stained it, and that
now we're
strips
using
our teeth.
chemicals.
So,
Yeah.
so something that I do is I use a reusable metal straw for my coffee so that my coffee is not staining my teeth or whatever tea I'm going to drink. And because that's a hot beverage and it makes your straw really hot, that was something I learned the hard way. What I decided to do is to just stick it in the freezer. And then that way, when you stick it in your hot beverage, it not only makes your beverage to the temperature of being able to drink it right away, but it also makes the straw warm to the touch and not cold. So that's my
So put the straw
little,
in the freezer
yeah.
and use a
And
metal
so,
straw. Okay. I like that.
So that's my little MacGyver.
Yeah, I think
technique.
that helps get it past your, ripping all the enamel off your teeth when you're drinking something acidic, especially.
Yeah.
By the way, coffee is acidic, guys, FYI. I know we have a million coffee drinkers out there.
Yeah. All right, Magic Moppers, thank you so much for tuning in and taking this journey with us. If this episode held some magic for you, please share it with your friends and family. This would mean so much to us. And don't forget to join us on our Instagram page at The Magic Hour and let us know what your favorite episodes have been so far. We appreciate all of your feedback and want to know what's lighting you up.
We do, and we release a new episode every Monday, guys, so you can catch us again next week or go listen to some of our past episodes in our podcast library. We'll meet you there. Until then,
be a light.
Be a light.
All right. This is going to be an editing.